Hey, Suzanne here with caregiverhaven.com. So we have a couple of really great questions again sent in from our members, and thank you for sending them. I really appreciate them. If you're asking this question, then I can't tell you the number of people who have asked it and have the same problem you do. Here we go. Mom is 86, tiny and very unsteady. The doctor wants her blood pressure lower, quote, lower, but every time they adjust her meds, she gets dizzy standing up. And I'm worried that we're preventing one problem and creating another. And she lives alone and she refuses to use her walker. She won't even use her cane. And she doesn't care. And I don't need a perfect number. I just want her safe. What blood pressure meds tend to be better tolerated after 75? And this is from Nina, who lives in New Jersey. Thank you, Nina. This is such a valuable question. And the reason I tell you this, first of all, you have to understand that many people who have high blood pressure or hypertension are on multiple blood pressure medications, and they don't understand why. And the first thing I have to explain is that there's so many blood pressure medications out there, and they all do different things. Okay, so think of the heart as a pump, and it's pushing blood through the vascular system, the arteries and the veins, right? We don't want the pump to push so much pressure through that it's expanding the arteries and veins. It's wearing them out. They're elastic, and we don't want to lose that elasticity because that pushes the blood through every part of the body. So we don't want these high blood pressures. The other thing is we don't want the heart to have to pump too hard because we're going to wear out the heart. So this is measured by blood pressure. The pressure is going to determine if the heart is overworking or we're overworking and expanding those arteries. So what do we want to do? We want to lower that pressure. And in doing so, one might lower the pressure by being a diuretic, taking more water or volume out of the blood. The blood is 98% water. So if we get some water out of the blood, maybe that pump doesn't have to pump so much water at one time. Another thing we might do is slow the pump down. Let's turn the motor down a little bit to a slow or medium instead of making it pump so hard and so fast, right? So they're your beta blockers can do that. Then we look at the vascular system, and we have blood pressure medicines that work on the arteries and those little muscles in the arteries to help them get more flexible. So even whatever the heart pump is doing, those muscles aren't affected by it. There's all different kinds of medications out there. I could go on and on, but that is why your doctor is giving your senior so many different medications. All right. So the next thing we want to look at is we want to look at a personalized blood pressure goal for seniors over 75 based on their balance and based on their frailty. Frailty being your mom is very tiny. She's very thin. Does she need all these medications? To tell you, think about it this way. Your mom, let's say 100 pounds. Let's say the guy sitting next to her is 250 pounds. Do they need the same dose? Of course not. Does the guy sitting next to her have more arteries and veins? Of course he does, because he has to do what? He has to get that blood to all those extra tissues, all those fat cells, through all the different things. 150 pounds more of blood, of tissues he's got to get through. So his railways, as I call them, or his vascular system is huge compared to your mom's. So your mom doesn't have, her heart maybe doesn't have to pump as hard as his heart has to. So is the dose the same? Absolutely not. Okay. So what is a good blood pressure for your mom? It depends on not only her weight and her frailty, but now it depends on her ability to stand up. Does she get dizzy? Does she want to fall over? Is she having that orthostatic hypotension, where she stands up and she gets dizzy. That means the blood is not getting to her brain. It's too slow and it's not making it up to her brain. So she's catching her balance. And without the blood, you have no oxygen. And when she doesn't have oxygen to the brain, she gets woozy, right? So we want to bring that blood to her brain quickly. And we measure that, by putting a cuff on her, sitting her on the couch, making sure that she's nice and still. We take her blood pressure. Then we mark that down. Then we say, okay, mom, stand up. She stands up. We wait a few seconds and give it a minute, not a minute, give it like 30 seconds and have her no talking during this time too. And she's standing up and you take her blood pressure again and you see if that number drops. How much does it drop by? And then what do? You have to let the doctor know this. You have to let the doctor know that you did an orthostatic hypotension test, and she had a drop in blood pressure of this compared to what she was doing sitting down. This is why she might be feeling woozy. It might also be that her hip hurts or her knee hurts or her foot hurts. It might be something else that's making her unsteady, but at least we can, rule out hypotension here. All right. Discuss the safest blood pressure medications for elder adults with the doctor. And are any of these on the BEERS list, the BEERS criteria, which says that seniors should be very cautious about these certain medications, and doctors either put them on them with warnings or the doctor doesn't put seniors on these medications at all. Make sure you look at all the other medications. You want to look at what have the pharmacist tell you if any of the medications have false side effects. For instance, many seniors are on gabapentin. Gabapentin not only causes falls, but mild cognitive impairments. It also increases the risk of dementia for long-term use. Gabapentin has a ton of side effects. So if this is something that she's taking with a new blood pressure medication, I would run, not walk, to my trusted pharmacist and say, hold up here. Mom is showing signs of wobbliness and I need to know what to do next. That is very important. Okay, question number 2. Dad's proud because his blood pressure is perfect now, but he's exhausted, slowed down, and looks washed out. He says it's worth it. I'm not sure it is. He has 2 whoa moments standing up, and he's skipping meals because he feels nauseated. How do I ask about safer options or a different goal without sounding like I'm arguing? This is from Paul in Georgia. Paul, I've seen this over and over again. You cannot live on your blood pressure numbers. You just can't. Every good provider does not chase numbers. That's an expression we use in medicine. We don't chase the numbers. We chase the patient. We chase the outcomes. We want to know how the patient is doing. If he's woozy and he's going back and forth, something needs to change. I have seen situations where the doctor says, you know what, I want you to take your blood pressure first. If your blood pressure is this number or that number, then take your medication. If it's not, maybe you don't need your medication right now. I also have a medication tracker for you. It's a free tool. It's a medication safety and savings checklist, and it's in your description. And I explain exactly how I did this with my patients, and I tracked their blood pressure for 2 weeks. And then they could tell me what their biological clock was, because everybody has a bio clock. And what they do is they take their blood pressure and they look at exactly when it's the highest. Is it morning, noon, or night? Or is it morning, is it in the afternoon? Is it night? Everybody's different. So we don't know. So we don't want to take blood pressure medicine when our blood pressure is already naturally low. Track the symptoms. You have to track the symptoms here, and you have to ask about the low blood pressure symptoms versus a normal adjustment. A new medication sometimes has side effects at first, but then they go away later. You have to know if this is the case. If it is, the pharmacist is going to tell you, not necessarily the doctor. Okay, and then ask if combination therapy at lower doses is safer than one high dose that's causing these side effects. Again, seniors who are 65 and above do not process medications like the 20-year-old or 30-year-old in great health. The metabolic systems are different. So this person might have a medication that's just too high for them. We can get them down, but don't chase the numbers. And your dad is probably not going to believe you about not chasing the numbers, because many times I had to say to my patients, you know what, go live your life and I'll worry about your blood pressure. I don't want you taking it anymore, because it was just too much for them. They were constantly chasing the numbers. And I said, you can't chase the numbers. I'll chase the numbers. Let me worry about your blood pressure. Go live your life. And many times that would alleviate the pressure they put on themselves. So this is a conversation, and I would set up an appointment today to meet back with the doctor who's giving them all these medications and say, hold up, you got to explain to dad that that blood pressure fluctuates throughout the day. And he's trying to get his blood pressure perfect every day in these numbers, and he's got to stop worrying about that. All right. Because it's a range. It's not necessarily one perfect number, and it certainly isn't for everybody. Okay. So I hope this helped. I hope it gives you food for thought. And it's always going back to the doctor, going back to the pharmacist. These are your two most valuable people to help you with this. And if this helped you at all, please subscribe to the channel, share it with somebody, give it a thumbs up so that YouTube will share it with other people. And be sure to get that blood pressure tracker that I'm giving you. Make sure you use that, as well as the medication safety savings checklist. Thanks, and we'll see you in the next video. Bye-bye.